Joining us now to talk more about recent coronavirus news, Huntsville Hospital infectious disease specialist Dr. Ali Hassoun. Thanks for joining us again, Doctor.
Thank you for having me.
And happy Thanksgiving, by the way.
Happy Thanksgiving to everyone.
Yeah, thank you. And in that vein, let's start with what we're thankful for when it comes to this pandemic. We could see some vaccines shipped in the next couple of weeks, correct?
Yes, yeah. So there's definitely great news coming up. Of course, you know, Pfizer have submitted the EUA to the FDA for authorization, and hopefully by mid-December we'll have more good news, whether Pfizer or Moderna as well. So these are very, very good news that we should be thankful and grateful for that, hopefully.
But what about the Thanksgiving surge that everyone's talking about? How concerned are you about a rise in cases following the holiday?
It is definitely, you know, concerning. I mean, we were thinking around Thanksgiving, we're going to have a week later the surge, but we've already seen it in early November. And the concern as people travel, as people gather together, as people unfortunately doesn't follow the guideline and the recommendation, it's expected we're going to see more and more cases. And already the hospitals is pushed to the limit. And it is going to be very, very concerning if we're going to see continuous increase and rise in numbers. But it's not only that, hospitalization, death, these are all things are preventable, and we need to work together to do it.
Yeah, I think maybe people hear the word vaccine and say, oh, it's coming before the end of the year. Maybe they're getting a little complacent.
So you know, the vaccine, definitely great news, but to have efficacy from the vaccine and results, this is going to take at least several months, because you're going to see initially the frontline healthcare workers and those at risk get vaccinated, and then the rest of the population. So this is going to take time. We're going to need to keep on doing the main prevention method, because it can take 3 to 4 months or more to have some effect. But the major benefit will be probably till about April and May.
Wow. All right. Well, we mentioned you work at Huntsville Hospital. Of course, we have healthcare workers in our family too. They're tired, they're stressed. The last thing they want is more COVID patients. Special shout out to all of them, by the way, this Thanksgiving. And Dr. Hassoun, how close are hospitals, you said this a second ago, how close are they to being pushed past their limits?
It's already, I can tell you, it's really pushed to the limit in the way of the COVID patients is significant. You know, it's already the numbers now more than what we have in July. The ICUs is affected significantly. So we already seen it. So if there's going to be more rise, it's unfortunately, it's going to affect the care, not just for COVID, but non-COVID patients. It's going to have major effect of how to deal with patients. And we really don't want to reach that point, because it can end up where we need to think about who can be intubated and ventilated and who cannot be. There's pick and choose things that we don't want to reach to that stage.
Yeah, this really does have a ripple effect. You mentioned non-COVID patients, and so outpatient surgeries, things like that, preventative care, that all gets affected.
Yeah, I mean, with time, as we get more and more COVID cases, it's going to affect what the healthcare system can do. Because if you do outpatient surgeries or elective surgeries and inpatient surgeries, you're going to need to have beds available for them. You're going to need to have enough healthcare professionals take care of them. So all these have a major effect if we have more and more COVID cases.
We just have a few seconds left, and I know we've said this a lot, but what can we do to prevent this from happening?
Yeah, I mean, you know, it's very essential that we follow the prevention, masking, physical distancing, hand hygiene, and avoiding the what we call the 3C, close contact, crowding, and close spaces as much as we can. So it can save the community and save lives. We can do it together.
Dr. Ali Hassoun, Huntsville Hospital infectious disease specialist, thanks again for joining us on this Thanksgiving night.
Thank you so much.